So I would tell any patient that has an anxiety towards dentistry or a fear of dentistry that, first of all, when we do dentistry here, we take every step very gently. When we numb the teeth, we use a topical numbing gel. We use an anesthetic that's been warmed and has a neutral pH so that when it enters the body, you don't have a stinging type of reaction. And when we start our procedure, we're going to make sure that that site is absolutely numb before we even touch it. And secondly, if the patient has an issue with being in the dental office, if the atmosphere is overwhelming, we can always offer something like minimal sedation to make sure that the patient is relaxed before we get started. We have several ways of doing minimal sedation. We can offer a little tablet for the patient to take ahead of time that will make them relaxed and almost and very drowsy, but they'll remain conscious throughout so that we can tell them to open and close and that they'll be able to respond. We offer another version of sedation in the form of laughing gas. And what that does is just sort of disassociate you from the situation, makes you feel a little bit lighter and less overly cautious about what's going on. And that's a good way of lightly relaxing a patient so that they can get through something like a tooth extraction or a root canal that might sound very invasive and scary, but in actuality, it's not. The way that we do things now is, for the most part, very minimally invasive because we pre-plan everything digitally before we get started. So we know exactly where our starting and ending points are in the procedure.